Hello, my name is Christina Bal. I am a specialist at the University Hospital of the Medical University of Vienna, and I will present you this recent study from the German asthma.net. Severe asthma often co-occurs with chronic rhinosinusitis with nasal polyps. The similarities in mucosal barrier dysfunction and inflammation have led to the concept of united airways disease due to the shared presence of type 2 cytokines, local immunoglobulin E production, and eosinophil infiltration, which make disease management challenging. We aimed to characterize patients with severe asthma and comorbid chronic rhinosinusitis with nasal polyps in a real-life setting. We assessed disease parameters and underlying inflammation in patients from the prospective multi-center German asthma.net. Variables were assessed by univariate t-tests or man-Whitney tests and chi-square tests. The study analyzed 1,746 patients with severe asthma. Of those, 35% had chronic rhinosinusitis with nasal polyps. The overall cohort was 57% female, in a mean 53 years old, and more than half had frequent exacerbations, which means 2 exacerbations or more per year. Patients with nasal polyps showed a significantly higher exhaled nitric oxide value, or FeNO, and significantly higher blood eosinophil counts, indicating a more pronounced underlying type 2 inflammation. Patients with nasal polyps received significantly more targeted treatment than patients without, with the exception of anti-immunoglobulin E therapy due to the lower prevalence of allergic asthma forms. In a total cohort, exacerbation rates, corticosteroid dependency, and uncontrolled asthma were serious and frequent irrespective of nasal polyps. We need to take into account that this study assessed patients with definitionally severe asthma with frequent exacerbations, high systemic corticosteroid dependency, and poor asthma control. Therefore, these parameters of disease burden were clinically comparable. However, when we regard only patients without targeted treatment, of which 963 were included in the study, the effect of chronic rhinosinusitis with nasal polyps on the burden of disease became clearer. We could detect more frequent exacerbations and worse quality of life in comorbid patients. To summarize, this cohort of patients with severe asthma and frequent ongoing targeted treatments already had a serious disease and treatment burden, irrespective of the presence or history of nasal polyps. Nasal polyps, however, marked worse exacerbation rates and quality of life in patients without biologics. Importantly, nasal polyps were a vital indicator for pronounced type 2 inflammation.